Thank you all for joining us this evening. Just want to say good evening. Welcome to this question and answer time concerning the COVID vaccine, where we're looking at how do I decide? And we know that so many people have got questions and concerns about the vaccines. And so we thank the organizers, that put this together, both the Luton Borough Council and the NHS for putting this together. We needed it. And so I'm happy to chair the meeting for this evening. We're going to start in a few seconds. We're going to get the mayor to give us a quick introduction as we get ourselves settled into this evening's question and answer time. And so in a few seconds, I'm going to get Councillor Maria Lovell to give us the introduction to why we're here this evening. All right, Mayor, over to you.
Thank you, Bishop. Thank you. Welcome, everyone. I feel very honored to be introducing this Q&A session discussing concerns around the COVID-19 vaccine. Tonight, we have a really great panel to help us understand the truth about the vaccine and to answer any questions that you may have. We're very pleased and thankful that they have agreed to give up some of their time this evening to be part of this panel. It is clear that our rates of uptake of the vaccine in Luton are lower than average, and we really hope that we can help to increase the uptake by hearing about the facts, the benefits, and the risks. We want to help the community of Luton to have the best chance of fighting the virus, and being vaccinated is one of the most important ways that we can hope to beat it. We have been working closely with the widest possible range of partners and have used our recent community vaccine pop-ups to encourage take-up throughout the whole community. Through those initiatives and sessions like this tonight, we hope that this will encourage those who in the past have either been unwilling or afraid to have the jab to come forward and ask all the questions. So thank you, and we're looking forward to a very productive meeting this evening. Thank you so much, and thank you to the panel once again. Over to you, Bishop.
Thank you very much, Councillor Maria, our current mayor. We thank you for all your support, and we appreciate you taking the lead for us to get this message out to our community. Thank you very much. Once again, just want to welcome everybody that's attended this webinar. I hope that you are going to learn something, and also all your questions, or most of your questions, will be answered. We are grateful that we got a panel of health practitioners here with us to really give us insight and answer all our questions as much as they can, to help us so we can also educate other people in order to make sure that we get these vaccines out to almost everybody. And so in a few seconds, I'm going to turn it over to the panel to introduce themselves one by one. I believe there are 5 of them. If you introduce yourself and who you are and what you do, before we get into the question and answer time. Thank you very much, panel.
So do I go first then?
Yes, you can.
So my name is Dr. Charles Asene. I'm a local GP who works in Luton. I work at the Town Centre GP Surgery. I'm the clinical lead for the surgery. I'm also the director of one of the primary care networks, which is called Oasis PCN in Luton. Alongside that, I'm the chairperson of a group of about 80 doctors of African origin who work across Luton. We work across Bedfordshire and Hertfordshire, called Afro GEP Hearts and Beds. And I've been in the forefront of the vaccination program from the onset, trying to get our community vaccinated alongside other ethnic groups. So I'm happy to be here. Just one thing to quite quickly add is that I'm in the middle of a very busy clinic. So if I do disappear, apologies. It's patient needs that have taken me away.
Thank you, understand. Next person, please.
Yes, hello, my name is Dr. Adil Ali Khan. I'm a local GP. I'm the lead GP at the Kingsway Health Centre in Luton. I'm also the chair of the Luton's GP Forum. I as well have been, like Dr. Sen, very, very involved in the rollout of the vaccine and very much involved in encouraging the uptake amongst the ethnic population within Luton. I've been practicing as a GP in Luton since 1992, so I know the area very, very well. And my heart and soul is in Luton, and it is all our interest that we have a good uptake.
Okay, thank you, Dr. Adele. I think his video is frozen. Okay, can we move on to the next person, please? The next person on the panel to introduce himself. Is Dr. Donald Palmer here?
Yeah.
Yeah, please introduce yourself.
Okay, so my name is Dr. Donald Palmer. Firstly, I'd like to thank the organizers for inviting me this evening. So I'm a scientist. Specifically, I'm an immunologist. I'm an associate professor of immunology. I'm also the Education and Career Secretary for the British Society for Immunology. They are the largest organization of immunologists, both here in the UK and abroad, with over 4,000 members. And I've also previously sat on the Medicines and Healthcare Product Regulatory Agency, that's the MHRA, and I've specifically sat on that panel when they were looking at concerns about yellow fever. So if there's any questions about that board, what does it do, what it constitutes, I can answer that. And again, thank the organizers, and I'm delighted to be here. Thank you.
Thank you. Is Suleiman here on this? Yeah.
Thank you, Bishop. Good evening, everyone. My name's Suleiman Rafiq. I'm a Senior Public Health Manager in Luton Council, and I have a remit around health protection.
I'll take the first bunch of questions, about 2 or 3 of them, throw it to the panel and see the questions that we'll get from them. The first one says, despite offering reassurance of what the vaccine contains to dispel the myths that they contain alcohol or pork, people from minority ethnic groups are still not convinced. Do you need a new approach? Do we need a new approach to basically to address the concerns of people who are not so sure about the vaccine? We go about 3 questions around the same, question, this concern. So can we have an answer to that? That do we need a new approach to address this?
If I may jump in.
Yes, sir.
I think, there's a lot of feedback. The question is quite right in the sense that there's a vaccine which is new, and people are a bit cautious about the vaccine. And that's because it's a new product, and people are generally cautious, and maybe Black people even more so than other races. Now, people will hold on to different things to try and justify their caution. So it started with all the initial things. It contains pork, it contains a luciferase agent, it contains microchips. And then we moved from there to fertility, and then we moved from there to other things. I think it's an expression of the fact that people are cautious and they don't know a lot about this vaccine, and they want us to approach it in a different way. Hence, if we dispel one myth, then another one comes on, another concern comes on. I think the approach for me is, for example, looking at Black people, is that we're very, very religious people. And I think the same thing with the Asians. And you can see that the Asians have probably a greater uptake than the Black people at the moment, because they've been able to go into the mosques and go into the temples and get the leaders in the temples to have the vaccine, and then take a picture sent to their group. And then they've done the vaccinations in those sites. I think the Black race is slightly behind in that because we're not doing that at the moment. We don't have a lot of Black pastors or preachers that like yourself coming forward to host events like this. Some are doing, but we have some also actively speaking against it. So I think one approach might be to actually tackle it from the religious point of view, which is apart from laying the facts on the table, which is what we're doing at the moment, is constantly giving them factual information as it comes out, is also to approach it from the religious point of view, which is what we're trying to do in Hertfordshire, where we're now beginning to do a lot of pop-up vaccine sessions in the churches, and we find that we're getting a higher uptake.
That's
So
brilliant.
I don't know what my colleagues will have to say.
Anybody from the panel want to add to it? We're looking at, is there any other approach that we can use to get this word out there to the anti-vaccine kind of group of people we have?
Speak at all?
Yes, Dr. Donald.
Yeah, I can comment. Sorry, Dr. Ali Khan. There's a couple of things I think which is really important from the outset. Dr. SN, I hope I've pronounced your name correctly, mentioned this. And one is to really recognize and respect the legitimate concerns the community has. So I think that's really, when we're having this discussion, is to recognize that, you know, the issue of medical racism, and really to treat the people with respect, because what they are concerned about should be recognized and then should be valued. And what's really needed, not just a new approach, and I'd really like to hear from Suleiman, is really around the public health messaging. Now, I'm a scientist, but what I'm aware around public health messaging is that they've been going for you know, targeting individual communities in a specific way. What's been quite interesting, once the vaccine was rolled out, there were no targeting or specific messaging for you know, diverse communities. And what subsequently happened is there's been that vacuum. And it's not necessarily people who are anti-vaxxers, but what people just want are some answers to questions. And I think and so what's really, my last point is, what's needed is not necessarily a new approach, but continual dialogue.
Right.
This is really key. So for Luton, this is really great. They're putting an event, but the challenge is you can't do one event. It's to do multiple events so you get that messaging. And I really like to hear from Suleiman, because what I've seen from the data is that the uptake is increasing.
Yeah.
And I think that's correlates to the number of discussions that diverse groups and leaders that are taking place. I'll stop there.
Yeah, well, I think to add to it, we you know, we've been working behind the scenes to try and get people from the medical field, from the council, to be speaking to the various community groups. I think 2 weeks ago, the mayor with Sandra Hayes went around various churches and speaking to them directly from their altars and pulpits, and they managed to reach a lot of people. I think it was that Sunday that, you know, so that's working, and a lot of us have been interviewed and really getting the message out there. So that approach has been working. It might be slow, but it is working.
Yeah,
so,
and it's not just events like these, but what's really required is for people like us and others to go to the community. I was on the Caribbean Social Forum, which is a group of older individuals. So speaking to them, been on the radio show doing that. So it's putting these events, but then those with the information, but equally the other point, and it's great to see, which I think the community was requesting, was people who look like them as trusted messengers.
Yeah.
So I think it's really what's been happening. is now the last few months, I think people have started to recognize this, and this is now what they're doing. But I'll stop there because
great. I think Dr. Ali Khan wanted to say something at the beginning, and then maybe Suleiman can round it up for us.
I agree wholeheartedly with everything that's said so far. Looking at it from the Asian point of view, I can definitely see that the Asian community can be divided up into thirds. A third of the Asian community definitely wanted the vaccine, no questions for it. The middle third, they were waiting to see what the first third happened, but they were a bit skeptical, but they're being won over slowly but surely. And then you have the last third who definitely have entrenched in their thoughts and their beliefs, and they're the people who've been very hard to get at. Now, what I have found is that in the experience that I've had so far is that definitely community leaders speaking out on talk shows, webinars like this, religious leaders coming out and having the vaccine and have their videos being put out on Facebook has made a huge impact and a huge impact on our community. Sure. And what I've also found out, a very targeted approach whereby the known GP of those patients who have been very, very resistant has targeted those patients and phoned them individually. I found that we've got a very, very good uptake of vaccine take-ups in that particular group. So if the vaccine hesitant group are being phoned by a GP or a doctor that they know and they trust, and that GP as an individual, I found that a lot of these people actually turn around. I personally, I've managed 80% of the people I've spoken to have been hesitant to come around and come forward and have the vaccine. The problem with this approach is it's very labor intensive and time intensive. That's the problem we've got here, and Suleiman can back me up on that. It's very difficult to do this in the long term, and I think as public health and quite a few of the doctors in Luton, we're creating a project where we're going to be trying to outreach to these decliners and hesitant uptakers to reach out to them, and hopefully we'll be able to turn this around slowly but surely.
Okay, good. Suleiman, you want to add a last word to this question, and then we move on?
Yeah, I think it's a really great question to start with, because I think it focuses us on our common goal. And so this, ultimately is about, there is no one single solution. This is about all of us coming together and coming up with ideas and suggestions to take forward. I know Luton was one of the first places to start the COVID Champions program, and that's been extremely successful as an engaged with hundreds of our residents. And, for us, I think it's about, we're here to try and enable what's going to work, and we'll take reflections back from our communities around what can work and what will help us move it on. But I think just to kind of summarize on this specific point, NHS England very recently reported that the uptake from all ethnic backgrounds has tripled, outpacing the national average across all ethnicities. And so while we can't be complacent, and I'm not suggesting we are complacent because there's still a lot of work to do, I think we have made positive strides recently, and we need to continue together. And only by coming together and learning together and taking this action forward can we protect Luton. We're very lucky in Luton. We're a relatively small town. We've got opportunities to work very closely together to get over this.
Yeah, thank you. That's a wonderful comment.
One point, Bishop. Sorry,
a quick one. Yeah, we've got so many questions, so quick one, Donald.
And this is really about language, something that I've recognized, and something I want to suggest to all of us is that instead of using the term vaccine hesitancy, because communities are concerned that they're being seen as blaming, I'm now using the term vaccine agency. So perhaps that's the language we should start be using. I just wanted to mention that. Sorry to cut you, but
no, that's fine. So that's a good way of looking at it. We need to address things properly, and that has a positive repercussions. So it's a good thing. We got another question. Moving on to another area. So somebody said, I recently got married, and I want to have children, but I've been advised that if I do have the vaccine, it can affect my pregnancy. So the big question is, what fertility concerns are there surrounding a vaccination?
Can I need to talk?
Yes, carry on, sir.
Okay, so at the moment, there's no evidence to show that the vaccines do affect your fertility, or if you are pregnant, there's no evidence to show the vaccine will have any detrimental effect to your pregnancy either. I suppose there's one caveat to this, is that most of the work has been done on the Pfizer vaccine and also the Moderna vaccine, because they're the ones who have been rolled out, and we've got a lot of data on those particular vaccines. So, as I said, all the data so far shows that there's no problem with taking up the vaccine. It will not affect your fertility. And definitely, if you are pregnant, you can still have the vaccine. It will not affect your pregnancy either.
Okay, thanks for answering. I think it's clear, the panel. Someone is also asking about blood clots. Can you please explain the risks and put it into perspective, the associated risks with the vaccine against other drugs commonly used? So if somebody's using, other medications, can they still take it? And, the risk of having blood clots. Can we have some education on that, please? Anyone want to take it out?
Yeah, I can take that.
If I may.
Yeah. So Charles, go ahead.
Okay. So what's come out so far, and this is all related, started with the AstraZeneca vaccine, started from Europe and then cascaded to the United Kingdom, where there was a bit of concern that some people who had the vaccine ended up with blood clots. Now, the MHRA and other bodies and JCVI have all done their investigations. And what they've come out with is that to put a very rare episode of a blood clot as a side effect. Now, the chances we had, by the time they put this on, we had about 79 people out of about 20 million people who had blood clots. And there was no clear evidence to suggest that the vaccine was responsible for this. Hence, it was stated that it will be put as a rare side effect or rare complication. Now, a lot of us take ibuprofen or Nurofen when we've got aches and pains. We've got probably have a higher chance of getting a blood clot from that than from having one shot of the vaccine. For those of us who take oral contraception, we have probably a 1 in 1,000 chance of getting a blood clot. So this is putting it in perspective. Whilst if you have the vaccine, the chances of you getting a blood clot, if you're over the age of 50, is probably 1 in a million. Whereas the chances of you having a complication or a fatal complication from COVID is almost 800 in a million. So those are putting it in figures and into perspective for people to understand that, yes, there is a possibility of a risk. It is very, very low. Right. So you have a higher chance of dying from a car accident than from getting a blood clot from the vaccine. That's how rare it is. But do we still drive? Yes, we do. Do we still get into cars? Yes, we do. Wow. That will be my take. I don't know what other panelists would like to add to that.
I was going to say, Charles, you've done, you've answered it incredibly well. But I also want to say something in relationship to, the public's concern about vaccines and how I think what the MHRA has done is hopefully to show the public how regulation takes place. So this is a situation, I've actually, as I said before, I've actually served on one of those boards when it became like yellow fever. So what the MHRA board is when there are any irregularities with a drug, experts will convene to look at the data and then they'll make recommendations. So I think the MHRA, which is independent from government, the fact that they came together and looked at all the data, I think should be even more encouraging to all of us who are in terms of vaccine confidence. This is actually a good thing. The data is not being swept under the carpet. They've looked at the data and now they've made additional recommendations, like as Charles said. So I just wanted to make that point because I think it's really important we highlight such activities, and anyone can still do that with any drug, you know, and particularly with the vaccine. It's called the yellow card system, which I know my colleagues and panelists will be aware of. And it's just that to say to the public, this is all things that is designed to ensure safety.
Right. Okay. Right. Thank you for answering those questions for us. Another question I'll go, and then we'll go live. If anybody's got questions that you want to ask live, please indicate, and that you know, the technical guys will let us know. But one more question, and then we'll try and take some live questions. It says, how can an unvaccinated person pass on the virus to a vaccinated person? I don't know whether it's something that can happen. So how does that happen?
I mean, once you've been vaccinated, it doesn't stop you from actually contracting the virus. You can still contract the virus, you can carry it and pass it on, but you will not be as severely affected if you weren't vaccinated. So the whole point of vaccination is that when you are infected, you are vaccinated, the virus inside you will not be replicating hundreds and thousands of times as compared to if you weren't vaccinated, indeed.
Right.
So the whole point of being vaccinated is that you will decrease that virus pool slowly but surely. And what we're looking at is to achieve something called herd immunity. If 70 to 80% of us do get vaccinated, the virus will have a smaller pool in which to breed in. And hopefully, that way we can keep this under control. And Dr. Donald Palmer might have something to say about this as well, being the immunologist.
Yeah.
Well, Dr. Ali Khan, you've put it excellently. The only point I will say, and in fact, this data has actually come from Public Health England. They've now recently shown that there is a lower rate of transmission, and there's also a reduction in severity. So this is the data that's coming out live as we speak. And so what's remarkable is that this vaccine does what all vaccines do, in the sense that it stops the spread of transmission. So as Dr. Ali Khan says, you know, the more people get vaccinated, the likelihood that we'll achieve herd immunity. And so far, the vaccine is doing what all vaccines do, and the data is remarkable. And I suggest, given the fact, what's been quite interesting, and I recognize that, you know, the scientific language can be quite difficult, but what's really great is that the majority of the research is actually publicly available.
Okay.
So what we're encouraging folks to do is to have a look, and most of the information is being produced in digestible form that's appeared in various newspapers. So a lot of data and a lot of information is actually being released. You see it on the BBC websites and other trusted news outlet.
Okay, well, thank you very much. Maybe by the end, one of you will give us indicators where we can actually get these sort of information from, just to help the panel, because a lot of people just talk and what they know is what they heard on the street, and they hardly go to the right information to read, the right places to read it. So if we can get some, right places to go and, read this information at the end, that would be really great. Suleiman, you had your hand to add to it?
Just a very brief point is we undertook some research when the start of the vaccine program was undertaken in Luton. And what was really interesting is that a lot of people didn't appreciate the point that Donald made, which was a lot of people said to us, well, it's my personal decision whether or not I have the vaccine. And if I don't have the vaccine, then that's a decision I've made for myself, and it doesn't affect other people. But I think what's been explained by the doctors is the impact it has on the wider community in terms of the spread of COVID specifically. So I think it's really important that people understand that you're not only protecting yourselves, but you're protecting your loved ones and your family and your wider community. I just wanted to make that point.
Okay, thank you. Okay, so let's take some live questions. We got Jill Dyson. Has her hand up? Jill? Yeah, Jill Dyson had her hand up to ask a question. Can we locate her?
Yes, can you hear me?
Yes, we can.
Oh, thank you. Thank you very much for the meeting this evening. Thank you, Bishop. A couple of questions, if you don't mind. One of them, people have been speaking about having to delay their Pfizer vaccine up to 15 weeks. And also, one or two people have been asked if they would actually combine the vaccines so they'd have one of one and one of the other. What do you reckon to that, please?
Yes. Who wants to take the first shot on this question?
Immunologically, as I said, Dr. Palmer's probably a greater expert than myself. I'm under the impression that definitely the longer you space vaccines apart, the better the immunological response you're going to get. So having to wait that length of time is not going to do you any harm at all. In fact, there are studies that can show that the longer you wait, the better the immunological response you're going to get. As far as different vaccines go, there are trials going on at the moment looking at people having the Pfizer vaccine and then the Moderna vaccine. Mixing. I suppose it makes more sense to have the Pfizer and the Moderna purely because they are the same type of vaccine, the mRNA vaccines. But there are trials with the Pfizer and the AstraZeneca vaccine. Whereas early evidence shows that you do get good response from having those as well. We've got to look at the full study for the results to come out.
Okay.
Palmer will have more knowledge of that.
Okay. All right, Dr. Palmer, you want to add to it? And before we do that, can I get the technicians to check the mic for Dr. Ali Khan, please? We're losing a lot of the things you're saying, Doc. So I don't know. You can work out with the technicians. Yeah.
So,
Dr. Palmer.
Yeah, Dr. Ali Khan is right in the space difference between the first and the second vaccine. And in fact, the early studies, these are like the clinical trials. So these were the practice runs that was done on volunteers. They actually did space them out. So classically, the vaccine is normally you give one jab and then you wait maybe 3 to 4 weeks. That's the standard practice. But some of the clinical trials recognize that the pragmatic approach may be to take one jab and then try and vaccinate as many people as possible. So because there was that possibility, those studies actually took place in the summer last year, particularly with the Pfizer. And as Dr. Ali Khan said, there's now data coming out that in fact, a single dose, and these are studies that have recently been published, can actually give protection, but you then need the second dose to actually to get full protection up to 90% odd. But there is no problem in waiting for that period of between 3 and 12 weeks. And I should point out, immunologically speaking, people have done studies not just with vaccines, but with bacteria and viruses on animal studies. And you can wait up to 6-7 months. The body has what's called immunological memory. It actually remembers that response. It's a fascinating system. It will remember that. And you can actually then wait 3 months, 6 months. So those are the studies that have been going around for years. So waiting for 12 weeks is not a problem.
Okay. Thank you. And just to point out, in Luton here, we do have, the clinics that are open up for quick access. So you can access if you're struggling to get your second vaccine. So please look for the information and it's all out there. Suleiman, did you put your hand up to say something in addition to this?
Yeah, it was just a very quick point, just in regards to for people listening locally. So just in Luton specifically, just to be really clear in terms of currently, and like the other panelists have said, there is research going on, but currently it's just to be the national requirement is to make sure that you get your second dose at 12 weeks within the 12 weeks. And if you can't make an appointment by week 11, then please attend one of the open access clinics or call 119. So I think just to be really clear is that this is obviously, we're learning more and more, but at present, that's the current guidance.
Okay, thank you. Dee, you got Dee has her hand up. Can you ask your question, please, Dee?
Hi there. Oh, hi. Good evening. Thank you for this. This is amazing. Lots and lots of questions, but I'm just picking out one. I'm going to ask you this one. This is really important. So in the various communities, there are people who I would describe them as Windrush type, yeah, who are not registered with GPs for fear that if they register with a GP, that their doctor may, pass them on to the Home Office. And so there are people in communities, including Luton, where they've just looked after themselves over the years. But right now, this is a public health risk, and they are scared to take a vaccine. What do you have in mind for people like that? What is the suggestion would you be making to people who are not registered? Because at the end of the day, they're here in the UK and there is a risk. Now, I know in some places they've got some organisations like homeless organisations that have been able to assist, but they've been registered because they get benefits. Yeah, so that's how that's worked for them. What's happening in Luton? Because we have Windrush people in Luton.
Could I answer? Definitely, we've had pop-up clinics in Luton, and we have publicly announced that if you are a person who is not registered, who has not got a GP, who you think your status is questionable, we do not ask any questions. We will still vaccinate. Your name will not go to the Home Office, will not go to the police or anything like that. Indeed, this is a group of people who we need to reach out to, because what's going to happen if we ignore this group of people, the virus will just accumulate in that group, and we're going to end up with mutations coming out of this group of people who have not been vaccinated. So definitely, in all the vaccination sites that I've worked in, we've openly said we welcome people who have got questionable status. We do not ask any questions. We will vaccinate you. We will not pass your name on to any official body, and we do not.
Okay, Dr. Ali Khan, we've lost you.
Can I just support what Dr.
Oh, yes.
Can I support what Dr. Ali Khan said? Yeah.
Go ahead.
And I think it's to say the same thing. So, it's just to reiterate what Dr. Ali Khan has said as well. He's a GP, I'm a GP. So reiterate the fact that we are vaccinating everybody under what we call breaking barriers to access. So there is no barrier for you to come and get your vaccine, just like Dr. Khan has said. You have a GP or not, you're visiting the country or not, you have a registered legal status or illegal status in the country, we do not ask you any question at all about the legality of your stay. What we want is for everybody to be vaccinated, because it is only when we are all fully vaccinated that we can start to move away from this pandemic, and also to try and make sure that COVID does not reside in a certain community. We can see what's happening in India, and we do not want to have a community where this virus can mutate and mutate and mutate. And then what it does is it undoes all the great work that have been done to vaccinate these millions and millions of people. Hence, because of that, the government has decided that there should be no barrier to anybody having the vaccine. So if you want to have the vaccine, you can have the vaccine at any time.
Okay, thank you. We got Ish. Ish has a hand up. Ish, you want to unmute yourself and ask your question, please?
Oh, hello, good.
Hi.
Yeah, okay. Just a quick question on the Pfizer vaccine, because they've been touting the very high efficacy rate of their vaccine, which is about 94% or even 95%. And vaccines like the AstraZeneca, J&J, Novavax, etc., I think their efficacy rate is said to be in the 80s and even below. A few weeks ago, I was listening to the news and I heard that the Pfizer people are they are planning a booster jab. So with that high efficacy rate, is there any reason why they're not planning booster jabs? Or is it the case that all the other manufacturers will be thinking along the same line, planning maybe booster vaccination to maybe bring the immunity of their population up? Is there any reason?
Could I answer that?
Yes, sir.
So as it is at the moment, we do not know exactly how long your immunity is going to last once you've had both vaccinations. We think it's in the order of 6 months plus, but we do not know absolutely. So we have to be ready for booster vaccinations, and this is why everybody's preparing themselves. And what we want to do in the future is we have booster vaccinations, we roll them out en masse, and we hope to actually incorporate them into the flu vaccination as well. So people have the flu vaccination and the booster vaccination for COVID at the same time. And if you think about the flu vaccine, it changes every single year. People don't bat an eyelid, they have the flu vaccination. And I think this is exactly what's going to happen with the COVID vaccination. We see new strains coming up, the scientists will be developing new vaccinations to combat those strains, and they will be incorporated into the booster vaccines that will be rolled out. So as I said, the main reason why we're doing this, because we think that the immunity to these vaccinations will last in the order of around 6 months, and therefore we will need booster vaccines in the future if that's the case.
Okay.
Thank you.
Okay. Right. I think Dee has a second question. Dee, there's nobody put their hands up. Yep. So Dee, you can ask your question.
Okay. So another question is about a younger cohort. So as the numbers go down in terms of age group, what are we going to be doing around encouraging younger people? Because we have masses of young people who are saying that they don't want to take the vaccine. So there's that. So that's a new problem. Then if it gets to that point that you start, vaccinating school children, you're going to have parents from communities, from Black communities that I can speak of, that will be very uncomfortable themselves, them taking the vaccine for themselves, let alone their children. Do you have a strategy in place or any thoughts that you can share with us regarding such matters?
Well, I can comment. Fortuitously enough, Dee, I was in conversation with an organization only today that were discussing ideas. When we were saying young, we were saying under 50s and under 40, 50s and 40s, which the government is now considering rolling out, because clearly messaging and targeting for older individuals is going to be clearly different today to say those that are in their 50s and 40s. I'd like to hear Suleiman's perspective on this, because I know other organizations are looking at because it's going to require different messaging.
Of course.
And to the point where the idea that I was in this meeting was, for example, let's use TikTok and use different forms. Yeah. I must admit, I did an event with Instagram. I know nothing about Instagram. But I was amazed that the average age of people who were on that platform was very different to the other events I've done.
Yes.
So it's using those aspects.
Right.
And I'm not a PR or marketing man. So, but it was just interesting listening to that debate, and that's what's needed to happen. And again, as I said, it's got to be one where there's going to be a continuous conversation. So you can't do an Instagram or TikTok once and leave it. It's going to create a dialogue. And I think the other thing really, actually talk and listen to young people.
Yes.
What their concerns are.
Yes.
And then go accordingly.
And I'm only saying that because I did that on one of my radio shows the other day, and I realized that the young ones are not looking forward to it. So I'm hoping that the public health people here in Luton and Bedfordshire will be really considering of a strategy to deal with that. Thank you for your response.
Thanks. Suleiman, you wanted to say something to add to it?
Thank you, Bishop. I think it's an excellent question. It's a really important question. And I know, we've started with the national comms in terms of as they're starting to look at, as they're moving down the cohorts and, the younger and younger cohorts of people around getting those messages right. We're a relatively young town in Luton, and so I think it's really important for us to make sure that we are getting the messaging right. And ultimately, it comes down to what I said at the beginning, is that this is about not just public health, what are public health going to do, but how can we all play a role in getting out that message around the importance of vaccination, including for our younger people. And so, again, we'll have ideas, colleagues will have ideas. We all need to come together and focus on what will work. And we can also learn from what's worked in other countries where they've already started vaccinating younger cohorts, and we see other countries have been relatively successful in doing that.
Right. Okay. Thank you. So there has to be a good plan, a good strategy laid
Can I just add a quick one to?
Yes, sir. Go on, Charles.
Can I add a quick word to that as well?
You can.
And I agree with what everybody has said, and I think it's a fantastic question by Dee, and it's something that I've also been talking to the CCGs about as well, is because the younger population will, most of them, I'm sorry to say this, they're almost anti-establishment, and they will fact check everything you tell them. So using social influencers, there is this set of people that they call social influencers who have millions and millions of followers, will probably be the way forward to try and get the younger population to take up the vaccine. And I've also suggested that you have to, for you to be able to get them on board, TikTok is a great idea. It's trying to make the vaccine also look cool. Because if you make the vaccine look cool, a lot of younger people want to be part of what is cool, then they might be happy to also take up the vaccine. So those are ideas that we need to start working on in collaboration with the CCG, and then trying to use the social influencers to get this message out.
Okay, thank you. Just one, we've got one other question here about antibodies. So, will the vaccine affect our natural ability to produce non-specific antibodies? That's the question. I didn't make it up.
So, how vaccines work by producing specific antibodies. So, and antibodies is what are a very important protection mechanism the body has. So the vaccine doesn't necessarily produce non-specific vaccines, antibodies. So it doesn't interfere with that at all. So, and vaccines are very specific for and the antibodies. So when you make a response using a vaccine, it's very specific to that vaccine, which is Ali Khan mentioned about the flu, which is one of the reasons why you need to have a flu jab every year, because the flu changes. And when you have that specific antibody response to one particular flu, then if the flu changes, then the antibody response you've made last year will not be effective. And that's why you need to have regular boosters for flu. So you don't make non-specific antibodies, because antibodies by their nature are not non-specific. Antibodies are specific.
Okay.
Can I just come in?
Yes, sir. Yeah.
I think it's really important for people to realize that one reason why we do not see diseases like measles prevalent, smallpox, diphtheria, tetanus, polio. One reason why you don't see these diseases so prevalent in countries like we're fortunate enough to live in is precisely because of successful vaccination programs that we've had in the past. And people take this for granted. People just take this for granted. So what we're trying to say is that, you know, the vaccinations will not hamper your immune response to any other illnesses at all. In fact, they will help. And with successful vaccination campaigns that we've had in the past, we've managed to all but eradicate certain diseases from the faces of the earth, thankfully.
Okay, that's a good one. Okay, we got some questions in the chat. I'll try and pick up a few. It says, if we're not vaccinated because we had the natural virus, if we're doing twice a week lateral tests and taking precautions and we are negative, will we be able to get a card from the GP that will be able to travel abroad to see family? So.
Is
that your final answer?
I don't either. Not at all. I think, look, what people have got to realize that, you know, if you haven't been vaccinated and you do contract the virus, you will become a larger breeding ground, okay, for that virus than if you were vaccinated. So this is the whole point of vaccination. The whole point of vaccination is that even if you do become infected, you will not become such a larger breeding ground. You will not be able to transmit that virus so easily as if you weren't vaccinated. And this is the whole point of vaccination in the first place.
Right. Okay. Good answer. There's a few questions on people requesting, say, can they request their own type of vaccine they want to take? Somebody says, can they actually pay to receive the Pfizer one if that's what they want? Can we get an answer on that? Can they request specifically what particular vaccine you want to have?
At this moment, we've got very limited resources, so definitely, and Charles will probably agree that we can only give out the vaccine that is given to us by the government, and they will supply the vaccines at a certain rate, and we can only give out what we can give out. We can't give out vaccinations that people want, you know, if they choose. I'm not aware that these vaccinations are available privately. Correct me if I'm wrong, but I'm not aware they are available privately at the moment.
Okay. But, you know, so somebody can choose to say, I don't want to take the Pfizer, or I don't want to take the AstraZeneca one, I want a Pfizer. Can they make that personal request?
They could be rated. As I said, we will only be able to give out the vaccines that we are given by the government. And definitely in the last batch of vaccines we had, we were told that the Pfizer vaccine we were given was specifically for second vaccines, not for first vaccine. So it's very difficult for people to make that choice. Very difficult indeed.
Okay. Look, most of the questions are quite similar. We've got one here. It says, I'm currently on the contraceptive pill, and I've been on the specific pill for 8+ years now. The pill itself carries an increased risk of developing blood clots, which I'm fully aware. My question is, as a 32-year-old woman, is it safe for me to have a vaccine whilst taking the pill?
The answer would be yes, definitely. And I had a patient who actually had a blood clot, a deep vein thrombosis, and she'd already had her first vaccination. And she specifically asked, should I have another vaccination? Is it safe for me? So I consulted the consultant hematologist, and they said, yes, it is absolutely safe. Your chance of having a blood clot with this vaccine will not increase if you've had one so far already. So definitely, if she's on the contraceptive pill, there is no contraindication to having the vaccine. There's no higher chance of having a clot once with that vaccine either.
Okay. All right. Thank you. I'm very conscious of the time. I think we've got just under 5 minutes or so to our scheduled time. So what I want to do is to give you opportunity for each of the panelists to spend a minute to just give a word out. What is on your heart that you want to just let us know in this community while we put this whole program together? What's on your heart? What do you want to say? 1 minute, they said 2 minutes, but I think with the time, can we give 1 minute to each of the panelists to say something as we round up, please?
I would do this. I mean, we all have a duty to ourselves. We all have a duty to our family, but we also have a duty to the community as well. This is the one chance we all have that we can all make a difference. And we're actually seeing the benefits of the vaccination project in real time. We can see the vaccine being rolled out, and we can see the numbers going down. And we've just got to make sure that we keep our foot on the pedal, carry on. And I can understand people who have got the concerns about the vaccine. And look, as doctors, we are willing to talk to you. We are approachable at any time. If you want to talk to us individually, by all means, contact us and we will have a chat. We will have a conversation and we will try to answer your concerns individually. But please, if you have concerns, talk to us. Please do. And we're here to help you.
Okay. Dr. Donald?
Again, I'd like to thank the invitation. What I will say, what I said at the beginning, is that I respect everyone's concerns because these are legitimate. But equally, what's important, I'm not here really to force folks to take the vaccine because remember, it's still voluntary. What I think is important, and I'm really glad people are here, is that you get the correct information so you can make an informed choice. And I think it's really important that everyone here gather as much the correct information as possible, then you can make an informed choice. And I'd like to leave you with one point, because sometimes, and I think Dr. Ali Khan mentioned this about measles, and it's something I picked up when I've been reading, and I teach, immunology to medics and veterinary students and to science students. Apart from clean water, the major public health intervention on the planet, I'm talking about the planet, is vaccination. Second to clean water. So I just want folks to remember that because that's really important. As Dr. Ali Khan mentioned about measles, etc., diseases that if some of us who are old enough to remember, we're a scourge in society. So make sure everyone's informed, and then you can come to an informed decision. Thank you.
Thank you very much. Suleiman, you want to give your last word?
Thank you. Yeah, I think just following on from what Donald said, to this day, 2021, vaccines save 5 lives every minute in the world. It's a phenomenal thing that we're here in the UK. We're fortunate enough to have access to free and safe vaccines that not only will protect us, but will protect our loved ones. And so really is a plea for everyone that's been listening to this discussion. Hopefully they've been reassured around some of the legitimate questions people have, to spread that information into their communities. We've spoken a lot about reach. Ultimately, we all have reach within our families and within our communities. We all have a responsibility to get this correct information out. And just the very final point is, we are still in the phase of restrictions. And so just to continue to please observe, as people have been so fabulously in Luton, the hands, face, space, and fresh air guidelines that we have. And also the really important request to get tested twice weekly. And that information is available on the council's website around how to access testing. And as we've all said, to take the vaccine when it's available to you, and also to encourage other people. Thank you.
Thank you. Is Dr. Charles available? I know he's busy. Yeah, he did say that he might be engaged. So just to round up, thank you all for joining us, and thank you very much, the participants. You asked good questions, and I'm sure you've taken good notes. I'm not sure when the link of the recording is going to be available, but once it's made available, we will send it to the various platforms so that you can share it as well. Just want to say a big thank you to our panelists, Dr. Ali Khan, Dr. Donald Palmer, and Suleiman, thank you so much for your insights and your support, and Dr. Charles as well. Those working behind the scenes, Amanda and Sandra Hayes, thank you so much for helping us put this together. And I believe that a lot of us have been, educated a bit more. And we're going to go out there and keep pushing and not stopping at just one event or one, solution. We're going to tackle different solutions, make sure that the word gets to people. I just want to say I've taken the vaccine myself. Took the first one in January, and last month I took my second vaccine. And as you can see, I'm alive, I'm well, I'm still doing what I have to do for the community. I'm a good husband, good father, preaching well and everything. So, it's all good. Let us work with the facts that's in front of us. People that have had a vaccine, everything is well with them. Don't go with the lies and the conspiracy. They just throw you off and they put your life at risk. Please. The very community that we've been targeted, that the virus affects a lot, we are the people that are fighting that which has been brought. And I think most of the time people, those of us within the BAME community, we're very religious, and it can cause us to be quite superstitious and suspect everything. And so we need to sort of calm down a bit. And if we worship God, we know that it is God that we've prayed to bring answers to our prayer, to the plague. He's brought the answers that the researchers and the medical people have brought as a vaccine. So this is our answer to prayer. Let's not think that any miracle is going to drop from anywhere. This is a solution to help us get the whole world back into, a new normal, if we can say that. But then it's worth listening to the professionals, and we're really, really grateful to those of you who have made the time to come to teach us and to help us, and for everybody else. So thank you so much for being part of the webinar today, and have a wonderful week. And if there are any questions, you can keep sending them and we will try and get you the answers. Thank you all very much.